The following is a COVID-19 update statement by Minister for Health, the Honorable Nicholas Steele.
Good afternoon, fellow citizens. Today, Wednesday, April 29th, I announce the laboratory confirmation of Grenada's 20th case of COVID-19. At present, there have been 19 total cases on island, although I am pleased to announce that we now have 13 cases declared medically recovered. This means that the total active positive cases is now 16. Approximately 1,200 rapid tests have been conducted so far and 206 PCR tests. Those cover a broad range of geographic locations and sectors of the population. Many are contacts of positive cases and others are randomly selected or people who have reported possible symptoms. Although we have already tested or screened more than 1% of the population and we have a good idea of our national status, we are on a heightened activity level because of the new developments as it relates to a possible workplace cluster and the related contacts. The individual confirmed today is a 54-year-old female who is a relative of one of the positive workplace cases reported previously. She is presently isolated and monitored, as are all other positive cases. As per protocol, our health professionals are aggressively engaged in contact tracing, and all relevant contacts are in quarantine. As our COVID-19 National Coordinator announced yesterday, the Ministry of Health has expanded our teams and further streamlined our activities as it relates to contact tracing, quarantining, monitoring of cases, testing, administration, and general epidemiology, given the new developments and the implications for community transmission of COVID-19. We continue to commend our healthcare professionals and other frontline workers, such as the Royal Grenada Police Force, for their diligent service in protecting this nation. They have been working above and beyond their remit, even with helping to maintain compliance of individuals under isolation and quarantine. We are currently working to mandate safety guidelines for different businesses, given that we are seeing with this workplace, from which we have 5 related cases so far. While we have been emphasizing safety protocols at every turn, it is evident from this particular company that workplace safety was not followed rigidly enough, and that employees were too close in the proximity of each other. Therefore, this particular company is now closed for the duration of our tracing. We apologize to the general public, especially to the direct stakeholders and beneficiaries, but our actions in asking that the company stay closed are necessary in ensuring public safety. Please remember, it is quite easy to transmit a virus in the workplace, especially in enclosed spaces, where staff are in close quarters. That is why we ask that companies that are allowed to open only do so under strict safety protocols, such as wearing of masks or face covering over the nose and mouth, and practicing physical distancing of at least 6 feet, along with proper hygiene measures such as disinfecting public areas. We continue to add that everyone must stay vigilant and not drop their guards. You must take responsibility for your own personal hygiene as well, including frequent hand washing. We remind the general public that the precautionary measures are most effective when combined. So please wear your masks whenever you leave your homes, exercise proper hygiene, and practice physical distancing. We are grateful to those companies that are ensuring optimum safety measures for their employees, and we urge those who are not yet doing so to please commence immediately, or we will ask you to close your doors until we are reassured that you are looking out for the health and safety of your employees and this nation. We have seen a situation in Jamaica where over 150 employees and contacts of a single workplace have been infected with the virus. We are hopeful and working to ensure, as far as is possible, that this does not happen here, because of the pressures that our healthcare system will face and the lives that will be at risk in the process. Please continue to exercise extreme caution in the coming days and weeks. While the government continues to allow limited economic activity, we continue to put public health and safety first during this pandemic. We are not going to rest on our laurels until we are assured that COVID-19 is no longer lurking in our communities. This virus is too unpredictable for us to be complacent, whether as government, private sector, or individuals. Please continue to call our hotline at 538-4787 or 458-4787. Or reach out to us by any means necessary if you are, or anyone you know, is experiencing symptoms such as fever, shortness of breath, cough, weakness, abdominal pain, or diarrhea. Together, we can save lives. I thank you, and may God bless us all.
The preceding was a COVID-19 update statement by Minister for Health, the Honorable Nicholas Steele.